another session of Grab a Cup of Tea. Today, we are continuing on our COVID series, and I am really honored and privileged to have Melissa Kitzman, a very dear friend of mine. We worked together back in Michigan. She's a nurse midwife, and she's a nurse midwife practitioner. I also have Katie with us today in this conversation. So welcome, Melissa. If you wouldn't mind just talking a little bit about yourself, and also just define a little bit on who a nurse midwife or nurse midwife practitioner is.
Yeah. Hi, I am Melissa Kitzman. I am a certified nurse midwife and women's health nurse practitioner, as Vino said. I have been in practice as a nurse midwife and nurse practitioner for 6 years. Prior to that, I was a registered nurse for almost 11 years, kind of practicing in different areas of medicine. I've always kind of been called to women's health. So after I had my son in 2005, I did make the decision to kind of go back to school and become a women's health nurse practitioner midwife. And kind of my passion has always been to improve the care that we provide to women and make it a better experience, make sure that I'm advocating for women, because we tend to not do that for ourselves. So that's kind of always been my passion and my goal. I worked with Vino in a private practice in Michigan for 2 years, and then moved to Minnesota in 2016, and have been a midwife here in the South Metro Twin City area since 2016. What is a midwife? So a midwife is an advanced practice registered nurse, or like a licensed healthcare provider. We primarily provide women's health care. And we can provide care to babies up to the first 28 days of life. And kind of our specialty is women's health. We can do kind of all of your primary care needs. We also provide care and do all the labor care. So when you're in labor and getting ready to give birth, we also, do the births. We provide postpartum care and can kind of care for women for their whole lifespan. So that's kind of our specialty. And our specialty is kind of, as I always say, like, like our healthy women, that's primarily what we focus on, and really make sure that we're providing great care for the women in our community.
Thank you so much, Melissa. And COVID has thrown a wrench to everything. And so the big question around is, okay, how does COVID affect pregnant women? So let's start off by just some tips and advice to women who are pregnant during COVID. What would be your points that you would touch on?
Yeah, so primarily what we tell our women, they're always concerned about COVID-19 and kind of contracting that. And what we do know is what the CDC guidelines and the guidelines from the World Health Organization is the best advice. So what we've been practicing since March, right? Since last March, kind of wearing our masks, washing our hands, practicing social distancing. That's really the same for pregnant women also. So we really just encourage them to follow those recommendations. We do provide them the kind of websites that they can look at, like the CDC websites, and tell them just to follow that. And especially sometimes with travel restrictions, especially through the holidays, there were a lot of questions about that. And we really kind of meet them where they're at and kind of talk about their concerns and really help them make a plan that's best for them to really reduce their risk of contracting COVID-19.
In that vein, pregnant women are asking the question, what is happening with the placenta, and what is happening with that little baby I'm growing if I get COVID?
Yeah, so what the research has been showing that we have now, because now we have almost a year's worth of data, is there really has been very few cases of transmission of COVID to mom, and the transmission that they found, or the cases that they found in the newborn babies or the infants, were not actually in utero. So that means it does not pass from mom to baby inside the womb or inside the uterus. The cases were actually after baby was born and coming into contact with either mom or somebody else that had COVID-19. So that being said, babies being inside mom is really protective for them. and it's kind of protecting baby from that. And there is a little bit of research, and some research that they've been doing is, do the babies get antibodies, right? Do they get protection from COVID-19? And there is some new research that the World Health Organization and the CDC have come out with, saying that they think that the baby does get some antibodies from mom, and that there is some protection for COVID-19.
In that same regard, Melissa, what about breastfeeding around that? Any risks there?
Yeah, as far as breastfeeding, when this all started, when we were in the hospital, and it was March of last year, the early recommendations were really to kind of separate mom from babies, because they were worried about if moms had COVID, that the babies would also get it. And then kind of now that we have more research, what they found out is that it's actually not recommended unless mom is really symptomatic. So unless mom is really ill, they are not separating mom from babies, and they're still encouraging breastfeeding. And kind of some of the recommendations they have is really just, if you do have COVID-19, let's say you are a mom and you're breastfeeding and you have COVID-19, they're recommending that you still breastfeed and you just wear a mask if you are symptomatic, and wash your hands, and really trying to limit that really close interaction with baby kind of close to your face. But which is really hard to do, right? So that's kind of what they're recommending, and that's only if they're, COVID positive. Otherwise, I tell people, it's really just kind of wearing a mask. If you are COVID positive, if you're COVID negative, then there's really nothing to change, which is really good news for mom.
As you're talking with your moms in various stages of pregnancy, many are having questions with regard to, should I get the vaccine or not?
Yeah, we've had a lot of those questions. And so kind of from the research that we know, there's been some colleges, or like our bodies that we listen to, right? Our colleges like ACOG, which is the American College of Obstetricians and Gynecologists, the Society of Maternal Fetal Medicine, which is kind of the body that regulates all the high risk pregnancy doctors that do a lot of the research. And kind of what their recommendation is whatever the mom is comfortable with. So we have the conversation on, if you have the opportunity to have the COVID vaccine, how comfortable do you feel getting it? Would you like more information? So we do have some information, some early information that we can give them about the vaccine and how it works. What the early research has shown, and kind of what the colleges are saying, the experts are saying, is theoretically that it's a safe vaccine, because it is an mRNA. It's not actually from the virus itself. So what we do know from the years that they've had of research with other mRNA or that type of vaccine is that it is safe, and it doesn't give you the virus. There's theoretically no risk for it getting to the baby for breastfeeding. But we also respect, how comfortable the woman is with the vaccine. And it depends on her risk also. The other thing we talk about is, what is your risk of getting COVID? If your risk of getting COVID is really high, for example, you work in a hospital and you care for, patients that have COVID versus someone who, is maybe stay at home, or they're primarily at home and they don't have a lot of risk, that would be part of the conversation too.
Another question that we keep getting is, is there a high risk of respiratory complications during delivery if mothers are possibly tested for COVID, Melissa?
Yeah, so kind of what we do, and I believe I think every hospital is kind of doing this. Anyone who comes into labor, into the hospital, gets tested for COVID. So we do test everybody regardless if they have symptoms or not. And, that's kind of what we do for everybody. And what we've noticed is the women that are asymptomatic and are positive, there's nothing that changes with their care. So they still deliver they can still give birth. Nothing changes primarily with anything else of their care. The only time things, can change or get, I would say, a little bit more intense is if she does have respiratory symptoms. So she has a fever or a cough. And kind of what we know, if that's happening, then we do keep a closer eye on moms. But the risk of moms getting more severe illness, while they're pregnant is higher, and and primarily in the people that have other conditions. So for example, when I was kind of doing my research and when I look up all this data, one thing they noticed is like moms who have something like high blood pressure, as well as COVID, those moms are at more risk to get a more severe respiratory illness or be more ill, or a mom that has like asthma or some sort of other pre-existing condition, as well as COVID. Those are the moms that tend to get more sick. But the ones that are healthy without the underlying health conditions and are asymptomatic tend to not have any change in their care and tend to do really well.
In that vein, that you're so intimately involved with women throughout their pregnancies, are you finding that midwives are having the same access to hospitals and times during births? Is that changing?
Yeah, so primarily for the nurse midwives that work in the area, the majority of us do work in the hospital systems, and I feel like the access is the same for patients to come into the hospital. I think when everything started back in March, we did have a lot of patients that were scared of the hospital. They were scared of contracting COVID. So there was an influx into kind of the freestanding birth centers, which are close to hospitals, but not in hospitals, and the home birth midwife practices. That has, I feel like that has kind of decreased some, and we're seeing more people feeling more comfortable coming into the hospital. And as far as like a lot of the testing and things, the precautions that we did in the hospital, as far as wearing PPE, the birth centers were also doing, and so were the home birth midwives. So if you were any mom that was, let's say, at home with COVID and symptomatic, then they would have to come to the hospital as opposed to kind of giving birth at home or at a freestanding birth center, because of the risk of her getting more ill.
I think that's kind of a good segue to go into where do you find reliable information on the internet during pregnancy?
Yeah, so I usually recommend, what I always tell people, not to Google, right? Don't just put COVID in Googler. That's not a good idea. You'll get a lot of stuff. So or if you do that, only look for websites that have a .org, .org, or .gov, G-O-V at the end, because we know those are kind of the regulated websites that we know they have the scientific data that's getting watched by people. I feel like the best websites that I think are easiest for people to navigate are the World Health Organization, so the WHO. And then the CDC also has a really good, they have a special section just for pregnancy and COVID that I think is really nice. They also have a section for breastfeeding, for COVID and breastfeeding. They have a section for the vaccines. And I think for the last piece, because there's always questions about once baby's born, right? How long do we protect baby? Should they see people? Should we visit people? Should we do that? The AAP, or the American Academy of Pediatrics, also has a really good website to help kind of help guide the parents in that decision on what they're going to do and how should they quarantine, and kind of the transmission to baby and the risks and things like that. So those are usually the ones that I recommend. Are really the .govs, the .orgs, the WHO, the CDC, and the AAP are my top three.
And
yeah. Oh, I'm sorry, Vino.
Go for it, Katie. Yeah, go for it.
Have you found that how you're doing postpartum care for mothers has changed a lot during this time?
Yeah, we have. I think what COVID has done is challenged us to think outside the box, right? And I know, for years, I've always thought about, like when Vino and I lived in Michigan, how do we reach these patients, the ones that have a hard time getting into the clinic? They have multiple children at home, or they don't have reliable transportation. How do we provide care for them? So what this has done is really open that door to the telehealth model of care. And that's been really nice, and our patients really like it. The women really like it. We have options to either do phone visits or video visits. And with postpartum care, kind of what we started implementing is doing a 2-week visit with all of our moms and a 6-week. So we're kind of doing 2 check-ins with them. And if they need to talk to us sooner, that's always available also. So we kind of do a 2-week check-in, whether that's whatever easiest for them, whether that's a phone visit It can be a video visit, or they have the option to come into the clinic if they feel comfortable with that, and really kind of checking in with them, seeing how are they feeling, kind of do that, that mental health check. If they're breastfeeding, how is that going? Are they sleeping? All those, how are they adjusting? All of those big changes that happen in the first, 2 to 6 weeks after giving birth.
And just a final question, because with COVID and stuff like that, it's very hard for their husbands or spouse to accompany them and everything like that. So what would be other advice that you would give them? And is there other resources and help that you all recommend to navigate through this kind of challenging and exciting time for them?
Yeah, I think definitely not allowing the partners in, and not having the kids in the clinic or your appointments has been hard for some women. So I always encourage them, and to bring them on the phone, right? So bring them on FaceTime, bring in your tablet. We can put them on Zoom. That's totally fine. Whatever makes them comfortable. But I always encourage them to have somebody available online with them to listen, right? So they can listen and be present. I let them record, things like listening to the heartbeat, things that the partners are missing. We allow them to kind of record part of the ultrasound, so then the partners can be there, or they can be live on FaceTime and be present during those ultrasounds. So I think that has been helpful. We are starting to let people bring visitors into our clinic. So that just started. So I'm hopeful that will continue. And then at the hospital, I think the other piece, and that's important, is if people have a doula. So there's a lot of women that, see midwives that, and physicians too, that will have doulas. And doulas are kind of like trained labor support people that you hire just to be with you to help you during labor and birth. Specifically, they can also do home visits before and also do home visits after. So kind of in that, when you're leading up to pregnancy and then postpartum, those can be really good support people to have. And then at the hospital, they are allowing you to have like your spouse or your partner and a doula. So that is really helpful for women. So that's been really nice to have them back. And if, sometimes if, we've had a doula that had, close contact with someone with COVID, so then it turns into, okay, your doula can be on Zoom, and that's totally fine. And we let them figure that out. So I think we've done a lot of navigating during the challenges, and I think doing the best we can with technology. And I feel like the response has been good from the patients, at least having that option to have their partner or their support person on phone or tablet when they're in their appointments.
No, thank you so much, Melissa. Thank you so much for taking the time. This was really helpful. I think this is a very sensitive topic, and lots of people have so many questions. So thank you for taking the time for coming in. And, we'll definitely like to chat with you further.
Thanks for joining us with our discussion with Melissa Kitzman. We hope it was beneficial. We're really grateful for your following. We hope you subscribe. Thanks.